Homeopathy treatment of social anxiety disorder through BrainMindia protocol. Today I will discuss on the topic social anxiety disorder. This is a successful case study which I am going to present. SAD said social anxiety disorder. Sometimes it is called social phobia, and it is characterized by intense fear and discomfort in various kinds of social situations, and it often leads to avoidance behavior and significant impairment in daily functioning. This case study outlines the treatment of a 36-year-old male primary school teacher, which I diagnosed social anxiety disorder through my BrainMindia protocol, where he was treated through my protocol for 7 months. Patient profile: 36 years age, gender male, profession primary school teacher, diagnosis social anxiety disorder. When that patient came to my clinic for treatment, initial symptoms observed were intense fear of public speaking. He expressed intense fear. Also interacting with others, he had problems. He also had avoidance of social gathering and professional meeting. While doing so, he expressed he was having excessive sweating, trembling, and palpitation during social situations. Also, feeling of inadequacy and fear of negative judgment occurred during that time. As he is a teacher, he expressed dissatisfaction about his performance in the class because of difficulty in managing classroom interactions. Now, regarding treatment protocol, my BrainMindia protocol for social anxiety disorder, where I involved a combination of constitutional homeopathic medicines with triturations tailored to address patients' emotional and physiological and psychological symptoms. As a constitutional medicine, I had to choose aconite napillus 1m. It was administered to focus on alleviating acute anxiety episodes, calming the mind, and reducing physical manifestations of anxiety such as palpitation and sweating. Besides, I also prescribed trituration argentum nitricum 3x. Why? To target to improve confidence, reduce anticipatory anxiety, and support his emotional stability. Now I will discuss the treatment timeline and progress. Initial phase for 2 months. Medications administered aconitum napillus 1m, administered twice a week in the morning, and argentum nitricum 3x taken twice. Observations: within 1.5 months, the patient experienced symptomatic relief to some extent, reduced frequency and intensity of anxiety episodes during social interactions. He also expressed satisfaction regarding improved ability to manage classroom activities with less fear and hesitation. Noticeable reduction in physical symptoms such as sweating and trembling. Subsequently, in the intermediate phase after completion of 4 months, medications same continued. Observations were, by the end of 4th month, patient expressed considerable improvement symptoms, increased confidence in professional settings, including delivering classroom lectures and interacting with teacher's room, greater willingness to attend social events and engage in group discussions. He was able to do that. Also, further reduction in anticipatory anxiety and physical symptoms. As patient was improving steadily, so I decided to complete the case within 6 months. However, in the final phase, I continued medication for 7 months total. Medications administered, those 2 medicines in the same dose administered to maintain the progress. Last observation: by the end of 7th month, the treatment was successfully completed. The patient 36-year-old male patient reported significant improvement in overall social functioning and self-esteem. Anxiety episodes became infrequent and completely manageable, with no major relapses. Satisfaction was expressed with the treatment outcomes, and the patient resumed full participation in both personal and professional life. So in conclusion, we can say BrainMindia protocol proved effective in treating social anxiety disorder in a 36-year-old male primary school teacher. Symptomatic relief was observed within 2 months with considerable improvement. By the 4th month, the treatment was completed in 7 months, successfully addressing both emotional and physical symptoms and enhancing the patient's quality of life. As usual, I asked him to follow up after 6 months, and he came in due time, and there was no relapsation in the case. Thank you.